Hello, welcome to our final project presentation, which is about fighting COVID-19, an online severity assessment tool. Here is the outline of our presentation, and I'm going to start with the first part, project goals and requirements. The goals of our project is first, to design a platform that provides real-time remote monitoring tool for all the patients and healthcare institutions. It can also increase hospital and ICU capacity while reducing patients' exposure to this virus. And it can also enable healthcare institutions to monitor patient status in real time. There are also several requirements of our project. First, we need to create a patient view, which allows the patients to enter their vital signs and symptoms, and also creating a clinician dashboard to retrieve patient information. And on this dashboard, we're going to provide the patient risk in population health level and also calculate risk score for each patient in order to support clinical decision. This is our platform architecture. So when a patient logs in as a new patient, he or she can type in their vital signs and symptoms, and we're going to save their data in our back-end data storage. And when the clinicians come, they're going to log in and see a list of the patients and choose one patient to review. And then after they give some feedback, we can save everything to our back-end data storage. And next time when the patient comes back as a returning patient, he or she can retrieve this feedback from our back-end data storage. So next part is our team roles and contributions. So we have 4 group members. Shen-Yi Cheng works as a back-end developer, and he is responsible for generating fake patients' data and documentation. Yunlong and Wei Yang, they are responsible for front-end and back-end, and also Wei Yang serves as a project designer. And Bohua Wu is responsible for data visualization and machine learning model establishment. So the next part is our research based on industry problem. There are about 35% COVID-19 deaths cases, which are not taking place in healthcare settings, and there are approximately 7 million United States citizens who confirmed COVID-19 but waiting for recovered. However, the number of medical workers is far less than this amount. That's why creating a real-time remote monitoring platform is a must. We also researched based on the gaps in this domain. So first, patients really need a real-time upload and communication with their doctors because this disease really changes very fast. And also, it's necessary to provide patients some information and to keep the information transparency high between the patients and clinicians. And also, we need to reduce the clinician pressure about patients' distribution and later follow up.
We interviewed some potential end users like patients and health providers. They provide some good feedbacks. Most of them like the visualization on Clinician Dashboard. It's clearly showing the COVID-19 risk by race, gender, and age groups. There's some negative feedback on the application too. The dashboard looks plain. Color change, elements, rearrangement may improve the appearance. It, however, affects about a million of each vital signs can help a patient understand the medical terms. The go to top to view record ID should appear after user submitted data because before submitting a new data, there is low record ID on the top. Record ID is too long to memorize. One suggestion is use the last 4 digits of social security number as a key to search instead of using record ID.
Okay, let's come to the most exciting part of the presentation, which is the demo of our website. From this website, you can log in from anywhere as a new patient who input your information, or as a returning patient to retrieve the doctor's recommendation, or you may review any patient as a clinician. Then you click enter my information as a new user. You enter your last name, first name, gender, date of birth, and vital signs as all numbers within the reasonable range. And you check some symptoms as you observed yourself, as well as the medical conditions that you know about yourself. Then you check all the confirmation box. Then you can submit your record. So, so this message told you that your record have been sent to the back end and you have a record ID. And then your information is pending for review. So you have to wait. Here is also your record ID. You can copy and paste. This is important for your future retrieving. Then let's act as a clinician. We use admin login ID and password. We see two lists. The first list is outstanding patients sorted by the submission date. So we see our Bob Wolf is on the last day we just key in. So it's appear at the bottom. We click to look at him. So the first section showed the gender, race, and age, and also three graphs showing the COVID death percentage grouped by age or grouped by gender or by race. And we use the yellow bars to indicate the patients belong to which group, and you can know how this guy positioned in the population. The second section is again the vital signs, symptoms, and medical conditions as originally input. Then based on this data, the model based on the literature can calculate for a risk score, which is 11 for this case, and it can also calculate the death rate. Then based on these two numbers, the model also suggests a risk group from low to high. And of course, as a clinician, you have discretion to make an adjustment based on some specific situation. And then you can make recommendation. As this risk is very high, I recommend to come to clinician immediately. And then you can check two confirmations and then submit. The data is saved. Then in this list, we see the Bob Wolf appears in the second list and disappear from the first list. Means he has already been reviewed. Then Mr. Wolf may retrieve this decision by using record ID and his last name. Then you simply click this link. We go to the bottom. We see the recommendation, the risk group 4 out of 4. That means very high. And we also see the recommendation. As time goes by, the situation may change, right? You can update your data, vital signs, for example, you gain your weight, and this one may be better. Then you can resubmit your information for a new review. So after that, we log in as a clinician again, and we see this Bob Wolf appear again in the outstanding list. We select, and we see this score probably changed. Whatever, it can change. It may remain the same, and you may make new recommendation and submit. Yeah.
Status and Gantt chart. Here is our Gantt chart. You can see in the early stage we are focusing on the front-end architecture, design, and layout. And in the mid of period, we are focusing on our machine learning model and random forest algorithm modularized and data visualization. And in the last stage, we are focusing on our model visualization implementation to the front end and test and report writing. The last part is the discussion of future plans and opportunities. We would like to deploy on AWS EC2 and using modern databases such as MongoDB to store our data, and scale up our project to store more information and provide real-time update to improve our user experience and user interface. Last, we would like to promote our idea and solution to raise the healthcare efficiency to help more people get recovered. Thank you.